Good evening, everyone. I hope the audio visual is okay. You can see me, you can hear my voice clearly, and I hope you can see this cursor moving here on the board. So, people who are in, please just give me your thumbs up. Let me know that the audio visual is all okay. Okay, so please just give your thumbs up, say hello to me, let me know that the audio visual is okay. Fine enough, okay, wonderful. So, I think it seems as if we are good to go. So let me quickly brief you the intent why I'm here today. With your NEET PG that's just gone by, and with the counseling due, this question is into minds of many people who've had a passion for orthopedics, and many people who are evaluating orthopedics as a career. So the purpose of this session is to, of course, give you better insights into this branch orthopedics as a career, to let you know answers to those frequently asked questions on this particular area, just in case you guys are willing to opt for orthopedics as one of your uh, career options. And the more important intent here, of course, to discuss a little bit about the counseling part, to what rank would these options would come up, and to discuss a little bit about the options beyond orthopedics. So if you go with orthopedics, what all else to get your hands on to for your future. So I'll be taking them all up. But before that, a quick introduction of myself. Dr. Mukul Mohindra, that's my name. I've done my MS in orthopedics and DNB as well. And then I have done this FNB in arthroscopy and sports medicine. So orthopedics has further scope also. That's what I intend to tell you. But I'll take you into all these insights in a detailed manner, step by step. Okay. So first of all, after studying so much, 3 degrees, after going through these 3 degrees, first of all, this word orthopedics became very clear to my mind. As an undergraduate, what my thought would be that orthopedics would mean anything that would deal with the bones and the joints. But eventually, after exploring so much of orthopedics, it's become clear in my mind that orthopedics, see, this word ortho basically means straight, and this word pedics basically means child. So maybe this is a branch that started to correct the deformities in children, but today it has grown way beyond that up. We generally think of this as a branch that will be dealing with maybe fractures, joint injuries, but let me tell you, today orthopedics deals with almost anything that concerns these limbs, the pelvis, and the spine. So just leave aside maybe the facial skeleton, the skull, leave aside a little bit of chest. Rest almost everything is dealt by the orthopedic surgeon in the limbs, the pelvis, the spine. So that is the whole scope of orthopedics for you, just in case you intend to pick it up as one of your career. Hello dear. So let's start with some of your frequently asked questions. Now, once you've understood that what all you will have your hands on to if orthopedics is chosen as a career, the first thing people ask me that, sir, is my rank good enough to go with orthopedics? So you've given your NEET PG, you've had your ranks. I'm sorry to say you've not had your counseling yet, but that's good in a way, because you've got that little extra time to re-evaluate your decision and to fine-tune your decision. So how much time first you have, let me clear it to you what I think. So the counseling was due to happen, but it got stuck up in bit of case that's held up in the Supreme Court. Now the court is on vacation till almost 9th of July. So with the vacations going on, I'm not very sure if they would take this matter that seriously. That's a matter of national interest, and they'll be coming out with a decision. I think possibly this issue is going to be resolved post 9th of July, likely in the second week of July, and somewhere around the third or fourth week, you might find things moving towards the counseling part. Once counseling would start, it's very difficult to say that what will be that exact rank where orthopedics would cut down. So what my experience has been over past few years, that in orthopedics you have option for MS and you have option for DNB. Diplomas are almost phased out now. So with MS, it generally goes down to 3 to 4,000. Okay, ranks where you can get that free seat where the fee is low. If you talk of paying that higher fee, the capitation fee for the private colleges, it can almost go down to 20 to 25,000 rank easily, fairly. Bad colleges, it could further go down to around 40,000 rank. So roughly this is, where you can eye orthopedics depending on what category you fit in. So this will be where you'll be getting that free seat in a good government college. Up to this rank, you can get a fairly good enough fee, but at a good enough seat, but at a higher price. And this is, where you take it up. Where you don't see the price, you don't see the college. So these are the domains to which MS in orthopedics goes. DNB slips a little more down, so you can add a little extra, maybe plus 2000 ranks here, maybe plus 5000 ranks here, and maybe plus 10,000 ranks here for the three categories. So this is the best area to eye orthopedics. We are getting a fee that is absorbable and we are getting a good enough college. So if you are into these ranks, you can definitely eye on orthopedics. Okay. Any specific query pertaining to this question? Any specific query pertaining to this question? I hope my audio visual is okay. Okay. Now, of course, I've spoken that there are two choices. One is MS and one is DNB. So it becomes, my duty to clear to you, is MS the only choice you have that you should eye upon, or is DNB also good enough as an alternative? So who has more patients, MS or DNB? Okay, so let me tell you, one side of a doctor is a doctor, the other side is a businessman. So the smarter businessman would have more patients. So let's not compare these choices in the context that who will have more patients. I think it will be the person who will be better trained would have the more patients. So who would be better trained, I would say, should be the better off question. So I'll tell you, see, MS you generally tend to find in the medical colleges, and DNB you generally tend to find in generally hospitals, not strictly medical colleges. Now medical colleges have been since ages running this tradition of teaching. The hospitals are a little new to teaching. So traditionally speaking, the training in MS would generally be better and the hands-on work would generally be higher, because that's been the trend since ages. Now let me tell you what I have seen with the DNB hospitals. I would simply say this process maturation. They have also, evolved. That's what I would say, that they've evolved into teaching hospitals. So certain places, even DNB in orthopedics is better than MS. So in a simple way, see, my preference till today is MS, because an MS candidate can further give in the DNB exam and acquire a DNB degree also. But a DNB candidate is never allowed to give an MS exam. This channel is blocked. Like I did my MS in orthopedics, I gave up the DNB paper and I acquired the DNB degree also. So I read both of them in my profile. The reverse is not possible. The advantage with the MS that traditionally it has had the upper edge. So prefer MS over DNB in most scenarios. But sometimes with the DNB part you're finding a much better hospital that has evolved very well into a teaching hospital. Sometimes you're finding the location to be very convenient, the fee to be more absorbable. So in the special scenarios, you pick up DNB over MS. So these special scenarios are basically personalized. Okay. you have to see to your case. Like there may be someone who's not prepared to go far away from home and he feels is getting DNB much nearer place. So for him going to a farther place means bad adjustment. So in that case he might pick up DNB. So see to those special scenarios. You're finding it's an exceptionally good hospital, go with DNB even over MS. Because now the difference between the future, you know, uh, prospects is not very much. The line has blurred a lot. With either of the two degrees, you can almost equally score well. But citing the fact that an MS candidate can acquire a DNB degree, citing the fact that traditionally MS medical colleges have been those classical teaching institutes with better work in hand, I would say keep MS a little over DNB. Clear enough? So your training part will also be better because this traditional stuff has been there since ages, while DNB is little new all to this. Clear enough with your query, dear? Okay, so I hope I've cleared up my preference in comparing DNB with MS. Now, very very common question that people would generally ask me with orthopedic, because they've traditionally imagined orthopedic surgeons as carpenters, drill, saw, screwdrivers, cutting the bone and pulling the fractures and reducing them. So many a times people come to me with this kind of a query that I'm not someone who's built very well, who's having a very good physique. So will ortho be my cup of tea? So I'll share my thoughts on it. Before that, there's a small question I think I need to take up. Would a corporate hospital prefer an MS or DNB? Well, dear, let me tell you the same thing. The corporate hospital will prefer whoever can give better results, so better patients. Okay, they don't see you as if you're MS or DNB. They see your training. All right. So traditionally, most of the corporate hospitals are being run by people who are MS, because older days there was nothing like DNB. People were only master of surgery, MS. So they are also having that approach that MS training is little better than DNB. So MS people get that little extra edge. But let me tell you, even I've had students who had been the DNB candidates in their time, and they've been performing exceptionally well. So how well you train yourself up is the bigger constraint, rather than whether you are MS or DNB, even to a corporate hospital or even to a government hospital. The line has blurred now, the difference between MS or DNB, but still that little extra edge towards MS is there. Clear? So prefer MS over DNB until unless you're into that special scenario where with that DNB hospital you're getting something extra. Fine? Okay. Now regarding this build part, so when I trained in orthopedics, something that I was clearly taught to be by my teacher, that if you are requiring force in your surgery, you're on the wrong track. Your knowledge is faulty, your technique is faulty, there is some problem that is happening. Most of the things have now gone effortless. Technology has penetrated into orthopedics like anything. So now this build is not much of a concern. You can strike it out. There are many areas of orthopedics, where you don't even tend to deal with fractures. Like I'm a sports surgeon, I generally deal with ligament injuries. There's hardly any force that is required in my surgeries. So don't go after the build. Go after your intent, your passion, your mind, and your heart, what it wants. Your heart has enough force to even rule the world, provided you have the passion. So go with what you want, rather than looking at your physique or anything. That's my simple message to you. The biggest part with the surgical field happens with orthopedics also, So there's a big apprehension, at least with an undergraduate. Whenever he's trying to opt for a surgical field, that I have actually been more or less a physician in my undergraduate days, because your exposure with surgeries is extremely limited. So this apprehension of seeing blood and fainting like an average person, that's there with so many people, and I know some of you might also be having this kind of an apprehension. Very much possible. So would you have that challenge of finding yourself difficult to accustom with that body part, seeing blood, fainting, nauseating, feeling suffocating? I'll tell you. After being a doctor for over 1.5 decade now, the most beautiful thing, I've learned about the human body, the power it has that nothing else has. Adaptation. Adaptation. So I think this is what differentiates body from a non-living thing. We adapt, we change, and we alter ourselves to adjust to the environment. See, you are in a bad area, it smells bad. You stay there for long, the smell is gone, body adjusts. So the same thing happens. You might have those little tough days in the initial few months, few weeks, I would rather say. But then you very well adjust. Nowhere these things haunt you in your life or even in your dreams. So please don't hesitate with this kind of a thought in case your passion is to go with the surgical field and even with orthopedics. Clear enough, guys? So any more questions still here? Yes, guys? So I hope I'm crystal clear with my thought. Okay, not leaving any questions to you either. Okay. The golden question, because there might be some females watching this up and some brave ladies, I would say, okay, who've had that thought of picking up orthopedics. It's just the same way, there are some men also who tend to pick up gynae and have a love for that branch. So sometimes, ladies also have a love for this branch orthopedics. And if you are, a lady and you have a passion for orthopedics, should you go ahead or not? Well, let me tell you, you will have little bit of problems in the initial days. Because conventionally an orthopedic surgeon has been thought of as a male with a good heavy physique, applying pressure, force, manipulating fractures, breaking bones. But orthopedics has seen a 180-degree turn over past few years. No longer so much of force is required, so much of energy is required. More of a passion is required during your surgeries. The instrumentation part is very fine. The instrumentation is almost energyless. So even as a lady, you can perform almost equally well as of now. That's what my thought is. The whole issue, for a lady orthopedic surgeon is to win over the patient's heart. Patient is not able to absorb easily. So somewhere down the line, you might have a little bit of problems, finding your patients initially. But with your good training, your consistent results, you can very easily win over the hearts and eventually can build up a good OPD. See, there are areas within the domain of orthopedics: rheumatology, sports medicine, okay, and area like hand surgery. Okay, now many of these areas are predominantly physician part, consultation, OPD part, less of IPD. So ladies can eye up these areas within orthopedics, specialize in these small branches, and then the clinic runs equally well. So even ladies would have good enough opportunities. I've had students who've been females and who've taken up orthopedics because it was their fashion, and I think they've been satisfied enough. So you can go with orthopedics even if you're female, provided you have a passion for it. But yes, you don't have a passion, don't just put your foot into orthopedics, because somewhere down the line it's going to give you a little bit of struggle winning over the confidence of your patients. Fine enough? Any lady watching this up? Any query on this one? Or any thought coming to your mind you wish to ask me? Yes? So my thumb is up for the ladies also, in case you want to prefer orthopedics in your counseling part. But please do it only if you have a passion for orthopedics. Otherwise, don't put your foot into the mud. Yes, in case you go into orthopedics, don't just think that you're going to be one of those people who will need a good physique or anything. There are many branches where nothing of this sort is required. You can super specialize into those areas and go with the refined practice. Fine. The biggest part is orthopedics an end branch, because many people, they are lured into orthopedics thinking that's just an end branch. I do orthopedics and my life is set. See, this is the biggest misconception we are carrying since ages. We were in 10th class, someone told us just cross your board exams, life is set. Then someone told us no, it's plus two, cross it, your life is set. And then someone said going to MBBS, your life is set. Oh, I'm telling you, do even your PG, your life is not set. At least with orthopedics. The worst part I find with orthopedics, as of today, terrible congestion. See, I'm highlighting this word terrible for you. See, job opportunities are very limited. I think somehow orthopedic surgeons are already outnumbering the demand. See, this is not so with all branches. Anesthesia, plenty of demand. Radiology, fair enough demand. But if you ask me concerning orthopedics, I would say that terrible congestion. So don't take orthopedics as an end branch. See, that's where I started with the orthopedics career. But I found it to be too less. So added a couple of more things. And eventually I had to specialize. Now this is a super specialty degree FNB that you can pursue after MS okay in orthopedics. So eventually I had to specialize and further specialize and go into arthroscopy part, the minimal invasive surgeries. So that's where I felt, that this congestion is now gone. Because now there are limited people whom I need to compete with. So my message is clear that don't take orthopedics as an end branch. Congestion will eat you away. But yes, there are options after MS that you can follow that will relieve the congestion for you, provided you are prepared to work even after your MS for a while and specialize a little extra. Clear enough? Okay. So Alexandria, the prejudice you will have to face as a female orthopedic surgeon from your peers, as we have to get a patient into confidence too. Yes, there is little bit of that prejudice you might have to face, but I think at the end your patient matters finally to you, because eventually it does just becomes down to you between the scenario comes down to be between you and your patient. Okay, so if you can win the confidence of your patient, even as a female orthopedic surgeon, you will prosper. Some of the topmost institutes in this country, AIMS, Rishikesh, CMC, Vellore, have had their heads at orthopedic surgeons. UCMS Delhi also, I suppose, at time. So females have also made big names at times in orthopedics, and outside India, you find good number of female orthopedic surgeons. So India is also evolving. So I don't think that trouble should be too serious for you. You have a passion for it, go. Now the biggest thing, what all options after MS Ortho? So people go with fellowships into small areas that they wish to specialize in. But now a designated super specialty has been introduced into orthopedics in various branches. There's a NEET super specialty exam that happens your way. Then autonomous institute like AIMS are giving MCH degrees. And then this is the most popular exam that right now most of the orthopedic surgeons prepare for after their MS, the FNB exam. This FNB is there in multiple fields: trauma, hand surgery, spine, sports medicine. Okay, and good number of seats are there for FNB now, as of now. So people prepare for these super specialties, and it's must now to super specialize in case you want to tackle that congestion. Otherwise orthopedics you're not going to find easy. I am myself an FNB in sports medicine, one of the first candidates in sports medicine. I was the first batch, but a lot of batches have gone beyond me, and more people are now giving these exams. So once you get into the branch, you can catch me up for this further counseling, how to tackle up these super specialty parts, or you can even go for some fellowships also, just in case you don't want to give exams. But these are all MCQ entrance exams with the centralized counseling like a NEET PG after your MS. So you have to be on your tips and toes. The knowledge has to be right on your tips and toes, I would say, even if you've done MS. Clear now? How many years required to have qualification like you? Alright. So 2002 I joined MBBS. 2008 I started with my PG, so this was continuous, no drop. 2011 my PG was done. I started with SRship. I did it for 3 years, and after completing my SRship 2014 to 16 I did my FNB, and since 2016 I am professionally into work. So from 2004 to 2016, that's 14 years. So I hope that's a crystal clear answer to you. Well, there is not any gap in between here, no dropout, nothing at all. So when there has been no dropout even for a year, it's been 14 years. So that's the minimum input that you guys are going to require in case everything runs down in a single way. And no dropout even in my work. I joined, professionally my work the next day in my job where I am just in 2016 only. So it takes a long time undoubtedly, but I would say that you become a mature and a different person, so worth enough putting in those years. Okay, fine. Little bit about the scope for this branch, sports medicine. Now let me tell you, there are two ways to get into sports medicine. One is you pick up MD in sports medicine straight away after your NEET PG. The second is you pursue FNB. Now FNB is a post MS degree. So you have to first do your MS and then give the FNB exam. But FNB is in arthroscopy plus sports medicine. So MD, you don't have exposure of arthroscopy. Arthroscopy means the minimally invasive keyhole surgeries as of today. So this is by and large physician type of a branch, the OPD part. Now I would say regarding scope for both of them, I would use the word excellent, because not many people are right now familiar with these areas. Now the people with the sports who are taking up sports as a profession are on an exponential rise. वो बढ़ते जा रहे हैं, they are increasing. See, when I was a small kid, if I would tell my mom that mom, I want to go out and play, she would give me a slap. Idiot, sit and study. But I'm damn sure that by the time you guys grow up and you guys have kids, and your kid says, Mom, I'm sick and tired of playing, I want to study, you will give him a tight slap. Idiot, पढ़ना चाहते हो? 14 years, I'm nothing. Play. Because far better future with sports. So people with sports are growing. So demand for this part is growing. So you can opt for sport medicine as MD or preferably go with FNB after orthopedics. That's your choice. Okay. Just sharing with you list of few institutes that are running this degree called sports medicine. There's a 3-year MD course in these institutes with these seats. Few seats with us at Safdarjung Hospital, and then diploma course is also running up. Okay, in my FNB training, I happened to be at this institute for a while also. Very nice one. So these are some of these institutes you can keep in mind just in case you're eyeing sports medicine also. Okay, fine enough. And FNB you'll get to know once you get into orthopedics. Okay, so just taking up few questions. What about other fellowships? Well, I think too much to speak about fellowships here. This is again a full domain. You're into orthopedics and then we discuss fellowships would make more sense, because there are national fellowships, international fellowships, each with their own domain. Don't stress yourself as of now. First talk of orthopedics. Okay, is it okay to join PG in a college where cutting chances are not so much? Well, I would say, Sakti, fair enough, don't run after cutting. Okay, my answer is very clear that when you are a PG, your focus is to read and build knowledge. Okay, now post PG, there are fair enough options you have where you can move ahead with the cutting part. So choose colleges where this part is the better part, not cutting. Trust me, even people at AIMS don't get the best work in hand. Okay, so I think something seems to be wrong with the Is it so? Yeah. Just restart it up. I think something's. Are you able to see the screen or no? Is there a technical snag you guys are also facing? Something seems to be wrong on my side. Okay. I think something's wrong here. Okay, wonderful. So I think everything is back. Yeah. So going back here to the scope of sports medicine. Okay, so any more queries here? So any more queries here, guys? Clear enough with that? Fine. So don't run after cutting chances, Shakti. Run after that institute where you get more of knowledge and better concepts. You'll build up cutting. Okay, one last take. Orthopedics or surgery? Again, very common problem that people face, because I'll tell you, you generally have a passion for orthopedics because it's neater, cleaner, better reputation. But then what you're finding, what is luring you, that surgery generally goes a little down in the ranks. So you're finding better colleges with surgery. Okay, so sometimes you feel that should we pick up surgery at a better place rather than running out into orthopedics at some peripheral college. So my reply here is very clear. Choose branch over and above college. Okay. See, this is lifelong. You are going to carry. This is temporary. So see for what you have a passion for. Overall, I would score orthopedics a little above surgery, because I think orthopedics in itself is a super specialty of surgery. Today, just as a general surgeon, you feel too small. Your personal satisfaction is not there. So after surgery also you tend to go into neurosurgery, urology, gastrosurgery, somewhere else. So orthopedics is just on that domain. So far better satisfaction, better professional financial scenarios, better reputation, better peace of mind with orthopedics. But yes, if you have a passion for surgery, branch is over and above everything. So be clear with it. Okay. Is there any chance of getting MS Ortho for 40,000 OBC rank? Yes, there is. Definitely there is. Okay. So you can keep orthopedics as an option. Fine. So I'll just summarize everything up. We've discussed in this short scenario. So with the orthopedics, the best part I find, good enough reputation, reasonably good enough monetary aspects, provided that incubation is over because of that congestion. You have super specialized into an area, you have found yourself a good job, you've won over the trust of your patients with your good work, good monetary aspects. The quality of life is reasonably good. No real emergencies here. So you're bit having peace at your mind. Mortality part is low. Even if you want to just go into OPD or OT or maybe just an emergency part, everything is overloaded. So you are a lady, you just want to go with the OPD part, maybe because you're busy with the family life, fair enough chance for you. Fine. Super specialization options are available. I take it as a positive point, because this is what I think beats that congestion part with orthopedics. So don't take it as a negative part that this is not an end branch. At least if you're super specialized, you won't find yourself troubled with the congestion in the field. You'll be able to breathe. So overall, fairly good enough branch if you wish to opt for. But keep it in mind, it's not end branch. You have to go beyond orthopedics. Fine. Well, there are definitely negative works. Bit of manual work is definitely there, at least in the early days. But this goes off in a while. Congestion is the biggest problem, that in case you're not prepared to go for a super specialization, think twice. Very limited job placements, unless you super specialize. I'm clearing it in a crystal clear manner. Clear? And no way this is an end branch. Again, I'm telling you, you have to super specialize as of today. So that's how I would conclude the session, guys. Okay, so just a few batches coming up with us at Unacademy, the NEET PG 2022 batch. This is the test calendar I'm sharing with you for various subjects. Note your dates, get set. Okay, the NEET PG subscription prices you are fairly well familiar with, very economical, and the iconic subscription, Unacademy Prep Ladder, all in one go. The prices are about to increase, so quickly take your subscription. Okay, so that's all from my side for today. The list of colleges, I'll tell you the easier way. T.me Dr. Mukul Ortho. So I think the best way is that you can link up with me on this Telegram group and put in your queries for the list of the colleges, because very difficult to put all the colleges here in one go, and the same list might not be applicable to everyone. See, there might be a very good college in Chennai that may be the first choice for someone living in Tamil Nadu because he's familiar with the language, he's familiar with the culture. That may not be good enough with someone living in Punjab. So that is more personalized. So I would say that can be taken up in an individual manner, the list of the colleges. Fine. Anesthesia, I'm not the right person to talk of because I'm an orthopedic surgeon, but to me an anesthetist is a god. Very good scope. In case you're happy enough with that subclinical part, you don't have direct patient exposure. Otherwise, anesthesia I think is an excellent branch. Very good job prospects. Do you think after 10 years super specialty in ortho would be saturated? I'm not very sure. I think saturation super specialty is not easy. Could be, but at least not during the time you guys are going to go with it. You would have already made your name. So for this stage, super specialty in orthopedics is not that badly saturated. Fine. MRCS is again one of the options to do fellowships. So when you've done your orthopedics and you're planning to go with fellowships, that is where we talk of MRCS, not here. Okay, dear. So MRCS is not a super specialization. It is just one of the way to channel yourself into fellowships. That's what I would say. Okay. So any more queries, guys? I hope you could benefit. I could clear up some of those frequently asked questions in a crystal clear manner, leaving you with no doubts. I know you want me to discuss a little bit about the list of the colleges, but I think this is just not the right way. I can't put up a general list for everyone, okay, because there are so many individual choices. So better to discuss it on the group in a personalized manner. So fine enough, guys. Time for me to take a leave. Wish you all the best. So expect your counseling to be there somewhere around the 3rd or 4th week of July. Cases held up with the court. Court is on vacation. 9 July they are ending up with the vacation. You can think about the decision coming up just thereafter, and then the counseling might proceed. So prepare your mind accordingly, explore your choices, and catch me up if there's any confusion where I can help you out with. Okay, average salary, again you cannot generalize it here. It all depends how well you deal with your patients, how much patient load you build up from your competence, from the way you attend your patients. But yes, if you have done your super specialty, you won't find that much of congestion, so you will have a chance to gain your patients and build up your salary. With an orthopedic surgeon, salary part is generally good enough. Fine. So financial aspect is, I would say, towards the better side. Fair enough. Any other query, guys, or can I just end up the session? Okay, so good night for now. Any more queries, catch me up on the group. Bye bye.